Okay, so you guys are all here because you're interested, or someone you know is interested in being an egg donor. So we're going to discuss the process extensively and objectively, so you guys have all of the interactions understood. So first question we'd be having is, what is an actual egg donor? So an egg donor is a woman who is willing to donate her eggs to another woman who is infertile. So another woman that is unable to produce vital eggs on her own. So this can be done anonymously or semi-anonymously, meaning that there is a part of it that the donor is willing to provide. This is still on the same slide. That the egg donor is willing to provide some identity to the couple who is receiving the eggs.
What would be the difference? Why would you want to be semi-anonymous or not?
We'll go over it a little later, but basically it's like, do you want to be involved in the child that could be produced, or do you already have a relationship with the couple that you're giving the eggs to? So those would be the different scenarios. Okay. So an egg donor is a person that it could be recruited by the couple directly or through a third party. Third parties could be clinics, IVF clinics, which is the in vitro fertilization, or by different agencies that are connected to the clinics. And the clinics would be like the hospitals, the doctors directly. The agencies would be the people that just do the job of developing a list of applications of donors, and that the donors would go to before they would go to the clinics. A donor can be paid for this act, or it can be done gratuitously, meaning that usually if it's a relationship they've already had with the couple, they'd be willing to provide the eggs without any compensation.
How old do you have to be before you can?
I'm so glad.
Oh my goodness. Okay.
You want a younger woman to be that because it's there's less strain on your body from that, and you're able to produce typically more eggs. So the general age range is 21 to 34. Okay, so who can be an egg donor? You have to have regular periods because your physical health as a woman is completely vital to this process. They want somebody that's emotionally healthy because you are going to be taking hormones, and it's an investment emotionally. So you want to be stable. They are going to be looking at your extensive medical history, so you have to be willing and able to provide that. You can't have a history of drugs or smoking or any sort of process of getting off of the smoking.
Do they do drug testing?
They will, yes. They're going to do every kind of test on demand.
Okay.
And you're also, before you even get to that step, going to have to provide that in writing. And there's going to be contracts involved, so there's going to be a lot of legality behind it, so you really have no room to lie. Which goes into the next steps, which is that you have to be willing to undergo all of this and able to commit your time to it, because there's not a set time necessarily. I think it's usually 3 to 6 months is the process for how long this can take. So you have to be at the get-go willing to provide yourself at a second-hand notice. Oh, that's weird. This is supposed to be over there. But basically, there are pros and cons to being an egg donor. It's not all golden, and it's not all terrible. Some apparent pros are that you are going to be paid for this, and in the thousands. So this is the general compensation rate, is between $5,000 and $10,000. Anything more than that tends to be flagged by the IRS. Anything less than that, it is not worth your time. Another pro is that you are helping another family who is in dire need and absolutely willing and committed to creating a family on their own. And in the process of doing all this, you learn a lot about your own body and about how fertile you are. And if you ever decide to have children on your own or have had children previously and have had problems, this can help you learn a lot about that as well. Some cons are the risks involved, which is that there's a lot of people who claim to have regret afterwards. You only have a limited number of eggs that you create during your life as a woman, so you are...
What number is that?
It's not a specific number, so
Okay.
it's not something that you can say, okay, you only make 50 eggs in your lifetime, and you are legally obligating that you're going to give up 15 of those eggs to us.
Okay.
But it is a limited number, so it is a risk if you do want to have kids. And then with the hormones that you're taking is like, it's a lot of emotions that you're undergoing, and then when you are done with the process and you're done with all the hormones, then there's a lot of, like, there's like a spiral of emotions afterwards, so that causes a lot of regret also.
Like postpartum depression or something similar?
Kind of similar. We'll go into that further at the end, but it's just like you're kind of like falling off the cliff of, like,
It's a withdrawal symptoms.
it kind of is like a withdrawal. It's a good way of putting it. And then there's the whole fact that you could go through all of this and they might not get pregnant. They'll implant the eggs, they'll fertilize the eggs with the husband or the male sperm, and then it might not take, the woman might not get pregnant. So you went through all of this and it was for nothing, which is another thing that leads to the regret of it.
Do they let you know no matter what?
It depends on the contract that you sign,
Okay.
or if they're interested in trying it again, then the clinic or the third party could contact you and say, hey, it didn't work, would you be willing to try this again?
Okay.
And then all the risks involved surgically and medically, because you are putting your body through stress. So that could be a risk, is that something doesn't go right with surgery, or you don't react well to the medications that you're taking.
Do they put you under during the medical procedures?
Yes, they will put you under.
Okay.
Before you can even think about this, there's a pre-screening involved. There's an application process involved. So typically this is the way that'll work. You'll find the third party, either the clinic or the clinic, and submit an application through that party. The application is very extensive, it's very lengthy, and it's very detailed. You're going to have questions that you're going to have to answer about your own medical history, your own physical and mental state. You're going to have to answer about your parents, your grandparents. They're going to ask for proof sometimes. If you've had tattoos or piercings, they're going to ask that you supply proof that those were done hygienically. So you'll have to reach out to the tattoo parlors or the piercing parlors and get some sort of certification. If you've had any problems with drinking or drug usage, if you've had a extenuous sexual history, all of that stuff you're going to have to disclose in this application.
They do a DNA test?
They do not do a DNA test that I know of, unless you potentially disclose something in the application that makes them curious about it. But this kind of almost works as a DNA test because of how extensive you're going to have to get with your parents and grandparents. So they're going to look for patterns, because you're going to have to answer questions about your personality traits as well. So after you submit the application, you're going to have to wait for the third party to contact you, approve your application, ask for more background information, ask for details that they believe are missing, ask for verification on things, and then they're going to be the ones to approve the application, and typically they'll have some sort of platform that they'll post your application on so that couples that are interested in looking for egg donors can view it. So the couple is the one to decide when and if they want to use you, and then the third party will contact you saying that somebody has been interested in your application, and then that will begin the actual beginning process of potentially donating your eggs.
And when you submit the application, do you send it like a photograph?
Yes, you're going to send photographs. You're going to send probably a couple, because they want to make sure that you're fit. They want to know what you look like, what your physical traits are, because while you're going to have the father's traits, because the father's sperm is the one they're going to use to fertilize the egg, they're going to have your physical traits as well, which is why they want such a detailed information about yourself.
At what point do you find out how much you're going to be making? Is it after a couple decides they want to use you, they'll let you know
Yes.
how much they're going to?
Yes,
willing to
the
spend?
couple, once the couple selects you, they're going to contact you saying this is how much they're willing to pay you, and if you agree to that preliminary price, then the contract process will begin. Which leads us to the next slide. Very good question. So there are a lot of legalities behind donating your eggs, which is something that not a lot of people realize. Is because you're committing to helping create a person, that's a lot of pressure to place on yourself and on the other couple that you probably don't know. So they want to ensure that they're not putting all of this money and all of the ideals of their potential kids in the hands of somebody that isn't taking it seriously. So you're going to have to hire a lawyer. Most of the times, the agency will supply you with a list of lawyers. The couple who hires you is going to pay for it, so that's not an issue. The lawyer is going to, with the help of the other couple's lawyer, come up with a contract that you both agree on. So you're going to have to be in touch with the lawyer, go through it in depth. This is not just a simple contract. It's going to be 20 to 50 pages long. It's very detailed. And both parties are going to have to commit to it. So I thought it would be fun. So I actually took excerpts from a sample contract, and I thought it would be fun to kind of give you guys an idea of what this is like. So each of you are going to have a different excerpt, and I wanted you guys to read it out loud and then try to interpret what you think it means.
So do you ever meet the other couple?
If it's a typical anonymous egg donor agreement,
okay.
which is the one that we're looking at in particular, then you will never meet them. You won't know their names. You won't know anything about them except for maybe the general reasons why they're needing an egg donor. So how about Fran? Do you want to go first and read your part of the contract?
Sure. Donor understands that she is giving up any and all rights to the eggs and any embryos created from the donor's eggs and the father's sperm, including but not limited to fertilization, implantation, gestation, birth, and custody rights to the eggs, and any custody, visitation, or adoption rights or involvement whatsoever with any child or children that may result from the donation of the eggs. Notwithstanding the fact that the medical procedure necessary to obtain an egg, surgical removal of an egg from donor, differs from that for obtaining sperm, donor agrees that the conduct contemplated under this agreement is identical and or the same as that involved in the donation of sperm as specified under Massachusetts GL 464B, which states, any child born to a married woman as a result of artificial insemination with the consent of her husband shall be considered the legitimate child of the mother and such husband. Accordingly, donor agrees that her rights, responsibilities, and obligations shall be the same as the sperm's donor as defined under Massachusetts GL 464B. The parties specifically agree that the mother and father shall be considered the legal and natural mother and the father of the child under the law. Mother and father agree that the child shall be legitimate children of the marriage of mother and father and are heirs considering...
Okay, you can stop there.
Woo! That's
So
long.
it's a lot. Of what you've read out loud to us, what is your interpretation of that part of the contract?
It's just stating that the donor of the eggs has absolutely no connections, rights, or anything to after she gives those up.
Right. With a lot of legal mumbo jumbo behind
Right.
it. So whenever anyone says, why do you need a lawyer to go through this if you already know what you're getting into, it's specifically because of this contract. Because you never know what you're going to find in it. You do have the ability to make adjustments to it, so it's not just like set in stone contract. So you want to make sure that you're really asking questions if anything is confusing you when you're reading the contract. Allison, do you want to read your part of it?
Sure. Donor agrees that she may be contacted by mother, father, and or the child through the agency and or the IVF clinic after the child is old enough to understand the circumstances surrounding his or her conception if the child has questions about the donor. Such contact initially shall be made by and through the agency or the IVF clinic. Should the child want to meet the donor shall make a determination at the time the request is made whether or not to meet the child. If the donor does agree to meet the child, any further meetings after the initial meeting shall be done only upon agreement of all the parties. That means both the parents and everything.
Right. So what's your total understanding of what you just read?
That the donor is agreeing to possibly be contacted by the child or the parents down the line once the child is of age.
Mm-hmm. So that's very important for you to be aware of, that while this is an anonymous agreement, you are potentially agreeing to the child being able to contact you when they're of legal age.
But it goes on to say pretty much, but you still can't intervene or interfere in any way.
Right, exactly.
You still have no rights.
Exactly. And then, so if you wanted to make it that they couldn't contact you directly, but they could contact the agency, and then the agency could contact you on their behalf, like those are ways that you can get involved with this contract. Because obviously if you're doing this anonymously, there could be a reason that you're doing that and you don't want them to be able to contact you.
But if they say needed a liver transplant or something,
right, and
maybe.
you were like, this is my liver.
Yeah.
No. Then you'll say I decline.
My brother maybe that.
But you're not just like obligated to receive their their contact. So this is another reason again to get involved with it and talk to your lawyer about what you're agreeing to before you sign it. All right, Willie, what do you got?
Donor is over the age of 21 years and is desirous of entering into this agreement. B, the decision of the donor to enter the anonymous egg donor agreement is fully informed one, made after a careful and unemotional reflection of all aspects of this arrangement. Donor has come forward voluntarily without economic or emotional duress of any kind and has freely chosen to participate as an egg donor. Donor has or will prior to commencement of any treatment or connection of retrieval of eggs fully informed herself of the risk of egg donation, whether mental, emotional, physical, or otherwise, direct or indirect, foreseeable or unforeseeable. Donor enters this agreement with understanding that the agreement that shall forever waive and relinquish any of the rights to donated eggs, any and all resulting embryos, and any of the resulting children.
So what do you make of that?
That means you agree that you're in sane mind and
You're not destitute.
and you're not broke, you're not doing it for cash, and you have no rights.
Now, would you agree that a lot of people are doing this because they need the money,
But yeah,
or that they are emotionally invested in the outcome? So that's kind of something to think about when you're
so
reading
there's only
this
two
contract.
reasons why you wouldn't do it.
Exactly.
Yeah.
But
One or
And
the
they
other.
tell you you can't be either of those.
a lot of the complaints about egg donation is that there is that potential. These people are not. They are kind of destitute. That they're being encouraged because they need the money, or there's some risk involved if they don't do it. So they have to put that in the contract legally to keep it from being a lawsuit. So that is an interesting kind of way to think about it. But so yeah, so those are just excerpts from a very, very long contract. It's
50 pages of those.
These are only
potentially.
half
Now
pages.
every contract is different depending on the lawyer that you have. But it's so important that you don't even sign the contract or talk to a lawyer before you've met with medical experts that will be involved in the process. You can ask all those questions because as you read out loud, you're aware of the medical risks involved, you're aware of the emotional risks involved, and you won't be until you've kind of gotten some sort of idea of what the process will entail. So, any questions about that? All right. Okay, so after you've been screened, you will have another screening, which is kind of a 3-step process. The first is you will meet with a psychologist and you will have a very in-depth exam of your emotional state as pertaining to the legal contract that you are in, your sane and legal mind. They're basically looking for any trigger words or concepts that you might have about this process. So I thought it would be fun to give you guys example questions that you would face.
Yeah, what do you mean by trigger word?
You'll kind of maybe be able to tell in
Okay.
their questions, but basically they want to make sure that you don't have any fantasies or romanticizations about what it's going to be like. You're not going to have any regrets from the process. So the front of this page are sample questions from a psychological exam. Fran, why don't you pick a random one to read out loud?
How much information would you want the recipient and or child to know about you?
Now, when you read that question, like, do you have any concerns or confusion about that question?
No.
How would you answer that question if you had to answer it now?
Zero information.
So you have zero attachment, or you just wipe your hands clean of the whole process.
Right.
So that's kind of what they'd be looking for, that you don't have any attachment to the idea of the child, that you wouldn't want to learn about it, you don't want to potentially have connections to it, because that causes legal issues down the line. Mom, why don't you pick out another question?
Ooh, these are all good questions. Have you discussed egg donation with your parents? How do they feel about you passing on your genes to a child you will not raise?
So how would you feel about responding to that question?
As the donor?
Yeah, as a potential donor.
So, I'm a cool mom, but my mom would be very concerned about how many eggs I had, how this would affect her having grandchildren in the future, and it would be a difficult discussion, so I probably would not discuss it, so I would say no.
So that would potentially be a trigger for the
Okay.
psychologist, because if you refuse to discuss it with your family and then down the road they find out and they want to interfere,
Yeah.
that could cause problems.
Okay.
So those are just, again, another thing that they would look for.
Okay.
Willie, why don't you pick another question?
If you become an egg donor, will you tell your friends?
And how would you,
Yeah,
and why would you say yeah?
because I'm ashamed to have the guy.
So you wouldn't feel any shame or embarrassment or...
No, no.
Okay, so then that would be something that they would positively look for, because if you feel any shame initially, you're probably going to feel a lot of regret afterwards, and that's going to cause potential emotional issues down the road. So those are just kind of sample things that they're going to look for.
Could
If
you
you-
answer one for us? Let's do this top one. How do you feel about that? Can you read that?
Let's see. How will you feel knowing the family gets pregnant and you will never know the child for your genetic material? So I'm going to disclose that I've been an egg donor, so I had to undergo this extensively. And I freely answered that I was proud that there's going to be a mini Brianna out there in the world, and then I didn't feel any obligation to know them because I wasn't concerned for them at all. I knew they were going to be okay.
Very good.
But that's, again, what they're looking for, is that if you're going to feel that twinge of concern of that is my child, anything that's going to make them feel like you are all feeling like that is your child, that is a concern on their part that's going to flag you in their system. If you flip over to the next page, you're going to see sample medical questions, because the next part of the process is an extensive physical exam. So as a woman, they're going to make sure that you're healthy, like all over physically, but especially internally physically. So you're going to have a very invasive exam. If you've ever been to a gynecologist, it's like that on steroids. And then they're going to be very invasive in the type of questions that they're asking you. Allison or Willie, are there any questions that kind of stand out to you as concerning or strange?
Would you be willing to undergo a series of lab tests, including the HIV test, if necessary?
Yes.
That's some knowledge.
And that's a really big concern for them is because HIV is so contagious that if there's anything in the way you disclose your medical history or in your blood work that stands to reason, they're going to run as many tests as they need to make sure that you don't have any risk of passing on any HIV antibodies.
So all of this is happening, all this examination, etc., very expensive.
Mm-hmm.
A lot of doctors involved, experts, lawyers. So all this is being paid for in addition to what the donor is receiving by the parents?
Yes, all this is being paid for by the couple that
Wow.
is hiring. Yes.
So it's not just like a $10,000 investment for them. It's
No.
way up.
It could easily be 50 grand.
Wow.
Or plus.
Okay.
Yeah.
Wow.
It's
And is that per series? So if you go through it, say you spend 50 grand, you don't get pregnant. Do you get a lot of eggs to keep trying to get pregnant, or do you pay 50 grand per shot?
so
Right.
it completely depends on the way that the donor responds to the procedure. Because if the donor is able to produce a lot of eggs, you can either put them all in at once, you can put some in at once and freeze them, or if you don't have the money to freeze the extra, then you'll just put in what you feel comfortable with, and then the other eggs are going to be destroyed.
And is that where the happens when you put 5 eggs in and the woman has 6 children? Is that what we see on TV now?
Right, well, they would have potentially 5 children. The 6th one would definitely be an alien.
Plus the doctors.
Yes, but when you put in multiple eggs, there is the risk of having multiple twins,
Okay.
quadruplets, yeah, all of that.
Okay.
So that is a risk of putting in more than one egg at a time. Yeah. So once the physical exam and the psychological exam are undergone and you're approved, you're going to have a consultation again, because this is changed from PowerPoint to Apple PowerPoint. It's kind of messed up. But then you're going to have a one-on-one consultation with the head nurse or medical person of the process, who's going to be really detailed about what it's going to be like for you. The medications you're going to have to take, the commitment you're going to have, and then the actual final medical procedure where they're going to extract the eggs. So after you've had all that, then you will sign the legal contract saying that you are aware of everything and you are willing to obligate yourself to everything.
How long does the procedure take from beginning to end?
It completely depends on this next process. So the first step is that you have to sync the female cycles to make sure that you guys are on the same egg cycle of creating the egg and then distributing the egg in your body. So depending on how long that can take to start is how long the whole procedure will take. So that's why they say typically 3 to 6 months is the length of time, just to give some wiggle room. I can tell you when I did the procedure, this part of it only took like 2 to 3 weeks for us to start our syncing of cycles. Yep. And then once that happened, the actual egg fertility part of it was a month long, which is the typical length of a period. Because during the period is when you create the egg, and then once the egg is at its peak, then you're able to extract it. So in order for the procedure to work, the intended mother and the donor have to be on the same exact cycle. To do this, you're going to be taking a lot of medications. You're going to be on a really strict diet. And the medications will have to be administered at the same exact time between the intended mother and the donor. And that's what creates the cycle to be simultaneous.
Wouldn't it be easier if you just let them spend time with each other, or is that a myth?
It's not
anonymous.
necessarily a myth, but that doesn't happen to every woman,
Okay.
and that could take several months, so no, that's not easier. This is definitely the way to expedite the process.
So you just say, all right, you take your shot at 10 o'clock sharp every night.
Yeah.
I take my shot at 10 o'clock sharp. every
Exactly. Or it could be 2 a.m. at every night. Like it's as random as that.
Okay.
However, that because every extensive thing that the donor is going through, the mother is also going through to make sure that they know everything about your two reproductive systems. So that leads us into like, what are you taking as a donor? This is the part that people I think need to have more awareness about, because this is the part that takes the investment and the commitment. So during that month of after you've been synced, and you're helping to reproduce, to create these eggs and build these eggs that you're going to pass on to the intended mother, you're going to be taking 2 different types of medications, and you're going to have them typically through injections. So the first one is the one that makes the eggs, and so typically you just make 1 egg every month. So this is the stimulant that makes you develop multiple eggs. I could say the name, but it's a very long name. So they're going to supply you with these shots that you're going to have to administer yourself every month. So this first one, the follicle stimulating hormone, you're going to administer in your fat. So typically the wide part of your thigh or in your lower stomach, you're going to have to pinch your stomach in order to administer it, because that's going to be the less painful part of it. So typically that's done in the early morning, and then at night you're going to administer the second stimulant, which is called the gonadotropin releasing hormone agnostic analogies. That's a huge, crazy long name. Basically, this is what suppresses the hormone that makes the eggs grow as big as possible. This allows the doctors to control the way that the egg is grown and the timing of it. This is also administered in the stomach or the thigh. The needle tends to be a little bit thicker, so it's kind of harder to do. So they really suggest for both of these shots that you change up where you're administering the shots, because you're going to have a lot of bruising and a lot of tenderness. So if you're doing
2
it,
shots a day.
yeah, if you're doing it in the same spot, it's gonna be really painful for you. You will have bloating in those areas, so that's another reason to change up where you're doing it. The last shot that you're gonna do is the shot that you do when you're ready to have the egg extraction. So towards the end, let me see. Yeah, so before you're ready for the egg extraction, these are the general things that you're going to tend to endure. Is you're going to have, like I said, a lot of bruising and tenderness, and where you're putting these shots, you're going to have very specific times you're going to have to put the shots in, like I said before, and it's insanely important that you do it right at those times, because it could throw off the whole cycle. You're going to be held legally responsible if you throw off the cycle because of all the money invested in this. So that's another reason. You are injecting a lot of hormones into you, so there are symptoms that they may or may not disclose to you, but for that reason I want to make sure that I disclose them. It will disrupt your sleep. You're going to have problems falling asleep at night, staying awake during the day. You're going to have a lot of emotional uncontrollableness. That's going to lead to fatigue in addition to the sleep problems. You're going to be really irritable, and you're going to have, pretty much you're going to feel like you're pregnant. If you've ever had a friend, or if you've ever been pregnant yourself and you've had all those swells of emotions that you're dealing with, that crying uncontrollably and angry at the drop of a hat, nausea at a drop of a hat, hot flashes, you're going to feel swollen, you're going to feel like you're suppressing, you're like water is everywhere. It's pretty much what you're going to be going through. You will have to report on a regular basis. They're going to tell you when you're going to need to report to the clinic. They're going to have to do regular blood tests.
When you say regular basis, is that like once a week or once every 2 weeks?
So it's going to get more and more.
So it's like when you're pregnant, you start going once a month and then once every
Right.
week.
So
and
you're going to
every day.
go probably once a week, and then closer to the extraction date, you're going to go every other day, and then when they are getting closer and closer to it, you're going to go every day, because they're monitoring the way the hormones are reacting to your system. And then you're going to go to the doctor, and they're going to do probing to look into your fertility area, fertility area, to say it politely, to look at the size of your eggs to make sure that they know exactly when they're mature enough to extract. And then you're going to have a nurse calling you regularly to let you know like what track you're on, and then to ultimately let you know when it's time for you to take that final shot, which is why we're going to go back to this page for a second. This is the last shot, the human chorionic gonadotropin. It's a very large shot. It's basically the shot that dislodges your eggs from your system so that they're able to extract them in surgery. This is a shot that has to be administered not in the fat but in the muscles, so it makes it a little trickier. So for that reason, I found a video online. It is not graphic, but it does show you the general process of what it's going to be like to administer this shot. So I wanted to pull that up for you.
Now, this guy is generally done. You can do it one of two places. Most of the time, this is where you're going to do it, and that's right in the upper outer quadrant of a butt cheek here. Now, you can do it, and I'm going to have my little model turn around here for a minute. You can do it in your upper thigh. This is all muscle right here, too. And a lot of gals who are stuck doing the injections themselves will ask me, can I just do it here? Well, you can, sure. And usually I would just have you use maybe a 1-inch needle because there's not as much tissue here generally between here and the muscle. But I will tell you, this hurts a lot more. So you can do it. It's fine with me. Most people choose not to do it, or if they do it once and they never do it again, just because it is pretty sensitive right here. So again, most folks are going to choose to do it right back here. Now, easy enough thing for me to tell you to do is there are really only 2 parameters to do this injection. And I'll tell you, most often, when I have folks that maybe they've been on this shot for a few days or a week, and they'll tell me, this is terrible. It's horrible. I can't do it anymore. I'll tell them, come on in, let me take a look. They're usually still in cycle with me. I can see
She
them.
does have a lot of
And invariably, I'll find
preliminary talk.
above the top of the butt crack. So wherever we see a little butt crack, just about there where my
These are
finger,
shots.
right about in that.
These are shots that people can take for other reasons. So she's going through like all the different ways so these are people that typically have to take this every week. So that's why she's saying the people that are on the regular taking it wrong and complaining about the pain of it. So that's why I'm skipping over that part.
When I have folks come in and tell me, oh, they're sitting and it hurts.
Yeah.
This, first of all, getting it in the right spot.
She spends a lot of time with it.
It's literally the opposite of what we've been doing. And, we've been pinching up tissue because I'm trying to get the medication in the fat. This is an intramuscular injection, so I'm trying to get medication in the muscle.
And that's what's a huge difference between the shots that you're taking every day, is that you're pinching your fat to get it in there, versus this, you don't want it in your fat, you want it in the muscle beneath, so you have to spread your fat apart in order to get it through your fat into your muscle. So that's what she's clarifying right there.
I'm going to do the opposite here. Now, of course, I'm going to get a little alcohol swab and I'm going to clean the skin here. But instead of pinching up, you're going to find I'm going to do this. I'm going to kind of press down and make that taut. I'm trying to flatten out any fat she has right there. So I'm going to make that nice and taut. And again, my preference would be that patient would be laying down. And I'm all business about this. I've seen different techniques, and there is no right or wrong.
She's not going to
but
put it through.
mine
Look
is
at the
very
cast
interesting.
on.
Just be all business about this. Yes, basically the needle goes all the way in. And kind of like a dart at a dartboard, you're just going to all the way in. Now, one of the tricks we have to do here, because this is a deeper injection, you've got to aspirate and just make sure you're not hitting a little blood vessel, a little capillary or something. So once the needle's in, you can let go. And what you're going to do is you're just going to pull up ever so slightly on this plunger. I'm just going to pull up a little bit. And when I do that, 99 out of 100 times, I'm going to see what I just saw there, a little air bubble. And I know I'm going to be perfectly fine to do that injection. Now, I don't even know if in my 14 13 years, I might have seen this once. But sometimes if you were to ever see a little bit of blood come back out, that just means you must have hit a little capillary, no big deal, but I wouldn't necessarily want to do the shot right there. So I would just pull that out. I'd probably get myself a whole new setup and just maybe move to the other side and do the injection. Otherwise, like I said, when you're doing the injection, you're just going to, for me, I use just the weight of the resistance of the medication to do the shot. Now, afterwards, I like to do a little massage. Try to spread that medication out a little bit and just do a little massage there. And now, again, for comfort, I have some folks who, really most folks, go ahead and they rotate. They go back and forth and back and forth.
That's what she talks about doing regularly. So the other needles that you're dealing with are going to be pretty small, maybe a half an inch. This needle for this final shot is 1.5 inches long, and it's a little bit thicker. So it's a pretty big deal. So for that reason, and for the placement of where you're going to have the shot, you're going to want somebody to administer it for you. If you can't, when she mentioned earlier, you have that that place in the front of your leg that you're able to inject it. It is going to be more painful. You're going to have to be a little more careful because you don't have as much muscle there as you do in the upper butt. So that's just a risk. But that's why it's really important to talk to your nurse, to ask questions, to have somebody there with you if you can. And obviously there's a bunch of YouTube videos that you can watch if you're at all concerned. Okay. So, that's what it's going to be like before the procedure. What's going to happen is the nurse is going to call you and say, hey, your eggs are mature enough. Take that final shot, the human chorionic gonadotropin. They're just going to say the big one. That's what they called it when I did it. When that happens within, typically, I think it's like 30 to 36 hours is when your procedure is going to follow. So pretty much the day before you have your procedure, you're going to take that shot, and then you're going to have a day to let it set in, and then you're going to go to the hospital. So before that time, you want to make sure that you've done a couple things. You want to make sure that you've secured a ride from the hospital, because you're not going to be able to drive. They will not legally let you drive from the hospital. So that's really important. We mentioned trying to get help to administer that final shot because of the difficulty of it and the length of it. And then when you get to the hospital, you want to make sure you don't have any makeup on, you don't have any deodorant on, perfume, anything like that, because you're going to have a medical procedure and they're going to want it as quarantined as possible. Know that before the procedure happens, they're going to begin the sedation. They're going to administer it in you, but then you're going to have to walk yourself typically into the procedure room, because you're going to have to be able to place yourself in those tall stirrups. If you're a woman, have you ever been to a gynecologist's office, you've got those stirrups. Well, these are those on steroids, because they're even higher up, because they're going to have to get way up in your system and they can't do that themselves, so you have to be semi-conscious for them to do that. So they're going to get you ready, then you're going to walk into that room yourself, and then once
When
you're
you say
set
walk
up,
yourself, you're not all by yourself. The nurse
you're with
is
the
right there.
nurse, yeah, because they're going to be helping you carry the
Right. Okay.
that stick,
IV pole.
the IV, yeah, along with you. And then once you're set up in those stirrups, then they're gonna put you completely under. So the procedure is basically that they're gonna have this probe with a very long needle that they're gonna stick up and through you into your ovaries. And the needle is actually this like suction tube, and so they're gonna suck out the eggs through that needle, and that's the egg extraction procedure. So this is a nice image of what that would look like.
So the needle goes through the walls of.
The ovary?
Right. So this is the ovary.
Right.
So this is the vaginal wall. So yeah, they do kind of go, because there's no way for them to do that with a needle.
Wow.
Yeah. So that's why it's a little painful afterward. That's why there's a slight recovery period.
And they have no way of knowing how many eggs you're going to produce.
So post-retrieval, they're going to have you stay in the hospital at least a few hours. They'll probably wake you up pretty quickly to make sure that you're aware and nothing happened with the sedation. And then once you've been there at least 2 hours, then they're gonna let you leave. They're gonna make you leave in a wheelchair. They're not gonna let you walk out because of where the procedure was. And then they're gonna expect you to have bed rest for at least 24 hours. You will have some bleeding afterwards because you are no longer taking all of those hormones you've been taking for over a month. You're gonna have a crash from the hormones. So that's something to expect, is you're gonna feel depressed and sad for no particular reason, and that's exactly why. So that's completely normal. I mean, it varies. Maybe a few days, maybe a week, maybe a few weeks. It shouldn't take a month though for it to get out of your system. And then typically within the week, they'll just make sure that you've met all your legal obligations, and then they'll have that paycheck in the mail for you. That day, they'll be able to tell you how many eggs they extracted though. So right after the procedure, they can see exactly what they took out of you.
How many eggs did you give up?
I think I was pretty fertile. I think I gave like 18 eggs. It was a pretty significant number. Yeah.
And the party that paid you is entitled to all 18, correct?
Yep. All of them were legally theirs. Yep. So after the extraction, what you can expect is pretty much that's it. Like, so you have, it's like a big grand procedure, a lot of build up, and then you're just completely over with it. You have no interaction with the couple. You may or may not find out if it was a successful procedure. Like I said, if it's not a successful procedure and they're willing to use you again, the third party may reach out to you and say, hey, didn't work. Would you be willing to undergo this again? In which case, that's how you would find out it didn't work. But other than that, you're probably never going to find out whether or not it worked.
And if their child reaches out to you 18 years later.
Right. And for that reason, you have a legal obligation to let the clinic know of any address changes on file.
Oh, forever?
For at least 18 years.
Wow.
So that they can keep track of you. Or if anything medical happens, if the child is born and there's any problems and they need a medical history, then they're going to want to be able to get a hold of you. So, yeah. So that's pretty much it. So do any of you have any questions about what the process is like? Is there anything I didn't cover?
Is the downfall off of hormones more severe for some women than others?
I assume it is, just because people respond so individually to hormones. I mean, for some people, it's hardly noticeable when they're taking the hormones that something's happening.
Is there any type of help for women that suffer a very severe reaction, like psychological help, or is that never really considered because it's not that aggressive?
That would probably be depending on the type of insurance you have, because for this procedure, you're going to have a medical insurance on standby in case there are repercussions to the procedures. So,
and if there's any damage done to your uterus during the procedure, is that they're going to be held responsible for it?
So that's what you're going to want to look for in your contract. Yeah.
Okay.
If it's in the contract, yes. If it's not, then your insurance you're going to want to make sure your insurance will cover it.
And are there any documented cases where there's been damage that can't be fixed?
Oh yeah.
Yeah.
Yeah, because I mean, there's a risk with any type of surgery, and you never know how a woman is going to respond, even if everything is done as the way it's supposed to. Sometimes anesthesia or a needle down there can just somehow.
So what if they only were to get 2 eggs?
Even if they were to get 0 eggs, but you did legally everything you were supposed to, you'll still get paid.
Okay.
Now, if they can prove that you weren't taking the medication you were supposed to, that you were drinking caffeine or drinking alcohol, if they found out you were having sex and you got pregnant, you have the potential to get sued.
Wow. Okay.
Yeah.
So you belong to them for a couple months, basically.
Yes.
Would you do it again?
If the money was right.
What's the number?
I don't know the number. But it's an insane commitment.
Yeah.
So that is something that you just have to be fully aware of when you're starting it. Otherwise, you're gonna feel overwhelmed.
And do they typically use young single women, or do they?
No, you don't have to be single. You just have to be committed to not having sex during the whole period.
How did
And
you
not-
find out about it?
I think through like an online advertisement.
So then you actually called like the clinic directly. You didn't have to find.
I didn't even call. I just filled out an application online. It was like a preliminary application. It was really basic. And then they contacted me saying I might be eligible and sent me the very extensive application.
Okay.
All right. Well, thank you
Thank
for
you.
coming. Hope you guys learned stuff.
We did.
That's it.